update tonight on a story that we've been following about an outbreak at a South Bay homeless shelter. Officials with the Bill Wilson Center now say it's just too early to tell whether as many as 7 people could be infected with scabies. Still, though, the effort to contain the possible infestation is causing more concern. KTVU South Bay reporter Jesse Gary joining us now live in downtown San Jose with tonight's update. Jesse.
Heather, good evening to you. The Bill Wilson Center has only had the contract to operate the North County shelter for a month today. So earlier today, they took Fox 2 inside to tour the facility, take a look at their cleaning protocols, and to address inaccuracies, they say, in the apparent outbreak of scabies inside their shelter.
There are 0 confirmed cases of scabies at this time. A confirmed case would require the results of a skin test.
While CEO Josh Cello awaits official confirmation, Thursday a cleaning crew went through the paces at the North County shelter in Sunnyvale. Officials say the 3-hour daily sanitizing scrub is supplemented by a deep cleaning each weekend.
When I've walked through the shelter, I have felt that it is clean, it is tidy, that it's well taken care of.
They're living in a fantasy world to get better PR for themselves.
South Bay unhoused advocate Sean Cartwright says several shelter residents are under quarantine at a nearby motel due to scabies infection.
Scabies is a mite, so it infects the skin. It burrows into the skin, so it can cause intense itching.
Some showed letters from healthcare providers confirming they're suffering from scabies.
I knew I had something because my skin was itchy, fire-ish, and my head, I couldn't stop itching my hair. And they still didn't say anything, so I took it upon myself to go to Valley Med, and I came back with a notice, which they denied.
Some residents say the issue of possible infection cropped up in March when Home First was running the shelter. One man was isolated using partitions. Weeks later, at least 5 other residents showed symptoms of scabies, generally but not exclusively spread through skin-on-skin contact. One staffer is at home with similar symptoms.
Our concern is that, folks are being referred to or seen by a medical professional. We have made sure with Bill Wilson that has been happening.
Still, those battling the uncomfortable conditions say a slow and at times callous response by Bill Wilson Center has made things worse.
I think they could have handled it a smarter way by sending the individual, the actual host, away, or at least to the hospital.
It's not a matter of training or being understaffed. It is a lack of compassion. They just don't care.
There is no time frame for the return of tests either proving or disproving the presence of scabies. Also, there's the issue of reinfection. Those people who have gone through treatment, they also have to treat their clothing and their bedding in a very precise way. Advocates say there needs to be better education on that. We're live in downtown San Jose this evening. Jesse Gary, KTVU, Fox 2 News. Heather, back up to you.
And Jesse, really quickly, if I may, obviously we're focusing on this one particular shelter, but do we know if any other people staying at other shelters in San Jose have reported conditions, experiencing something similar to scabies?
Apparently it's localized to just this one shelter because of the need of skin-on-skin contact, or if somebody was infected, they'd have to go to another shelter. Apparently, as soon as they found out, or at least they thought that someone was exhibiting signs, according to Bill Wilson, they moved to level 2, which would be to quarantine or sequester these folks inside a motel and get them treatment, which would stop it there and not allow it to spread to other shelters in the South Bay area. So right now, it appears that this is contained to just the North County shelter, which is in Sunnyvale, Heather.
All right, our Jesse Gary, thank you. Appreciate it.
New at 5.